From the 6th of January, across the boroughs of Rochdale and Bury, there's going to be significant change to the way the health service delivers services to the local public. I'm Mo Jiva. I'm a GP in the borough of Rochdale, but I'm also one of the officers at Rochdale and Bury Local Medical Committee that supports and represents GP practices across the boroughs of Rochdale and Bury. For too long, patients have been inconvenienced by services they've received from the NHS by having to go to the GP to find prescriptions and sick notes and other things that they should have got in the hospital or from community services. From the 6th of January, GP practices across the two boroughs are going to stop providing this support to the community services and the hospitals. This is going to result in patients being signposted back to the service where they were advised to see the GP with a piece of paper such as this, which has a list of all the things that the GPs will no longer provide from this date. So what are the kind of things that the GPs will not provide? Well, there's 8 things in total. The first being blood test and requests for diagnostic tests like ultrasound and chest x-rays. If you've been seen by the hospital and discharged, or you've been seen in the outpatient department and you are advised to arrange a blood test or an x-ray, if it's within 4 weeks of you being seen, the hospital needs to arrange it themselves. Unfortunately, the GP will not arrange those tests. That includes requests from community services, which include district nurses, midwives, health visitors, or any of the specialist clinics, including diabetic, respiratory, or COPD services. So the first one is that GPs are going to stop arranging blood tests and diagnostic tests on behalf of community and hospital services. The second thing is where a community service signposts you to the GP to get a prescription. Sometimes it's podiatry, sometimes it could be the district nurses, sometimes it's the consultants at the hospital. And the advice is go to your GP and they will give you a prescription for antibiotics or painkillers. These services are run by Northern Care Alliance, which incorporates Rochdale Infirmary, Oldham Hospital, Fairfield General, and Salford Royal. They should be able to provide prescribers to support their community team to ensure that you get your prescription at the time you're seen within the community and not have to be signposted to the GP and then have to wait for the GP to generate a prescription. So from the 6th of January, if the service you are seeing suggests that you need to go to the GP, you need to advise them that the GP will not provide a prescription and that they need to do this. Any ECG, spirometries, blood pressure monitoring tests will also need to be arranged by the hospital. Where you are referred by your GP to a hospital department and you are seen by a specialist service, after being seen, if you are advised that you need to see another department within the hospital, the consultant should refer you directly to that hospital department. You should not have to come back to the GP for a new referral to be generated. This will make life easier for you and it will reduce the time taken for you to see the most appropriate specialist within the hospital. Also, if you are being discharged from the hospital or you are in outpatients and you need to collect a prescription from the hospital pharmacy, sometimes there are lengthy waits and patients are advised to go to the GP and pick up the prescription from their GP. As of the 6th of January, this will no longer occur. And also, if you're advised by the hospital to collect a sick note from the GP, this will not happen either. Generally, the hospitals tend to provide a sick note from the time you are admitted into hospital to you being discharged. But what they should be doing is providing a sick note for the full length of time that you are going to be off sick. So if you've had surgery, it shouldn't be a sick note up to your discharge date, but that sick note should include the recovery time you're going to need once you get home. You need to inform the hospital to ensure that your sick note is of a lengthy time to include that recovery period. And finally, we have shared care between hospital specialists and GPs. This is where medication that is specialist medication is initiated by the hospital and the patient is started on the medication and stabilized before which the GP takes over prescribing. GPs are generally happy to do this, but sometimes the medication may not be available in the pharmacy, or the medication dose needs to be increased or changed because the patient's age has increased. In that case, it's the specialist who needs to review the patient and reassess the appropriate medication and dose. In those instances, the GP will signpost you back to the specialist service. Now, this is not something just isolated to Bury and Rochdale. This is part of collective action, which is advocated by the British Medical Association, and it's something that GP practices across the country are undertaking. The only difference is that across the boroughs of Bury and Rochdale, we have collectively decided that from the 6th of January, we are going to take a hard and fast rule on ensuring that services that should be delivered by the hospital and community services are delivered by them, and the work is not inappropriately signposted to the GP. So please be aware of this, and if the GP does provide you a form, it's not because they're trying to be difficult. They're trying to make it easier for you to get the services that you deserve at the place and time that it should be delivered. Thank you.